This is the last one for the year. Hello, hi, how are you? This is the voice and the face of Dr. Tolu Olabinto. I'm the CEO, co-founder of Living Spring Family Medical Center here in the beautiful city of Mansfield, Texas, where we believe in helping our patients live long and well because the quality of life is just as important as the quantity of life. This is our first, well, not our first. This is our last Facebook Live for the year 2023. It's been a pleasure. It's been a privilege to serve you all through the years. And I'm so excited as to what 2024 holds for us. And so we thought to close out the year, we'll talk about the new year, the new you, and tips for a healthy and vibrant 2024. I don't know what's going on with social media today. We're having some technical difficulty, but we're still going to go nonetheless. We're still going to go ahead, um, even as I'm working on getting my guests on the show. If you are watching live, hashtag live. If you are watching replay, hashtag replay. And please do me a favor. If you if you if you don't mind, if you could tell me where you're watching from, that kind of gives me an idea to see where everyone is watching from, kind of get a feel for where my viewers are located. All right, so it looks like Facebook page is struggling a little bit, but we are live. Okay, awesome, awesome, awesome. um if you know someone who should be watching this, please comment, tag them, forward this to them so they can join us live, because we're going to be answering questions. And for some of you who are wondering, why are we having these conversations? Yeah, new year, new you. Well, it's important to maximize the year. It's important for us to live better quality and quantity of life, and so it's important for us to talk about tips to doing so in the year 2024. Um, and so that's why we're having this conversation. It's a new year. It's a new. Oh, you're watching from Nashville, Texas. Thank you for joining us, George Horn. Oh my goodness, so good to see you. Well, to text you or see your text. So good to see you. All right. Our guest will be joining us shortly. She is working on some I think some technical issues, but she is going to be joining us shortly. And I'm going to start this off by saying I want to encourage you, for those of you who are watching, to please set goals for the new year. When you have goals, there's something to look forward to. And studies have shown that people who have a vision or who have goals actually live better quality of life. So I want to encourage you to set those goals, because a better you, a stronger you, a healthier you is possible. All right, let's test this out. We got our guest. We got our guest. Can you hear me? Thumbs up. Yay! All right, let me bring her on. Woo! We made it. We made it. How are you?
I am doing well. Thank you. Thank you so much. How are you?
I am doing well. I'm doing well. I'm so honored to be having you as my guest. You're
Oh,
closing out the year with me, so yay! This is great. Um,
yay.
and for the sake of our viewers, Doc, could you introduce yourself? Who are you, and what do you do?
Sure, sure. I'm Dr. Janice Walker. I am a dual board certified family and lifestyle medicine physician practicing in Pembroke Pines, Florida. I see patients, adults across all stages of health and with chronic medical conditions, but I'm shifting my focus towards helping overweight adults achieve healthier bodies so they can look and feel more confident.
So they can look and feel more confident. I love it, and so nice to meet a fellow lifestyle boarded um, doctor like you. But why do you do what you do, Doc? Why do you do what you do?
You know, I was drawn to medicine at a very, very young age. At the age of 9 or so, was just fascinated with the circulatory system and the heart and its interconnectedness with the various organ systems in the body. And I thought, you know what, we are so blessed to have this human body, this fine piece of machinery, and so we're charged to take the very best care we can, right? So, went to high school, graduated at 15, moved to the States, did undergrad, studied biology, psychology, and went on to medical school and chose family medicine as the
Mm.
specialty because I felt that that specialty would provide me with the ability to provide comprehensive care for patients. Fast forward a couple decades in medicine, I've seen the impact chronic medical conditions can have on individuals, families, and the community as a whole. And so, with my lifestyle medicine training, I've tailored my practice in such a way that I can assist patients make those healthy lifestyle changes so that they can attain health and maintain health.
Internet today, but we're here. All right. I'm glad that you do what you do. What you're going to talk about is very, very important. That's why the internet started. Not going to let that happen. All right. I love what you do, and I agree with you. To carry out our function in life, to live our best life, we got to take care of this machinery that God has gifted us. So,
Yes.
yes, indeed. So my question to you, because we're talking about, new year, new you, and tips on how to live a healthy and vibrant 2024. Well, why is the new year often seen as a fresh start for adopting healthier habits? And how can we encourage our viewers to kind of hone in on the new year motivation? What would you
You
say to
know,
that, Doc?
it is, as the name implies, new year, fresh start. It's like we get a do-over. It symbolizes a new beginning. And so with that sense of a new beginning, a fresh start, we have this heightened motivation to do something different, be different, right? And so we are more likely to take stock of where we are now, make assessments of where we want to be, and we have that motivation to put some of those things in place. And so this is the time of year when we hear a lot of folks, oh, I got to eat healthier for next year. I got to lose weight. I want to, be this healthier me. I want to be more fit. And they're more receptive. We're more receptive to making those changes now. And so I think it's a matter of recognizing that, but putting in place, putting in writing, making it hardcore what it is that we want to do, where we are now, where we want to be, and having that roadmap to get us from point A to point B.
All right. I love it. Now, for those of you who are watching, you don't have to wait till the new year. You can start
No,
tomorrow. Just
ex-
say, just say.
exactly.
Now, you said something. You said, the new year, new you. It's like, yeah, everyone's excited. But studies have shown that by week three, uh, 50% of people are kind of like they're done, waiting till next year to start again. What would you say are the biggest obstacles or challenges when people are trying to face healthier habits, or they're trying to adopt healthier habits, and how can they overcome them? And it's important we have this discussion so people can brace themselves for the challenges ahead.
Right, right. Oftentimes the goals are unrealistic. That's number one. So individuals sometimes try to bite off more than they can chew. So
Hmm.
take weight loss, for example. There may be a wedding coming up in March, and someone may feel, okay, I have 50 pounds to lose because I have to fit into that dress. If
Hmm.
that person hasn't been exercising, if they don't have that roadmap, if they don't have that support, it's going to be hard to achieve that goal. I don't run, for example. There's no way that I mean, I may say I want to run a 5K by the end of January, right? Or run a marathon. But if I don't know how to run, how am I even going to accomplish that? Right. So for me, that would be unrealistic. Time constraints is also another factor. So depending on the schedule, depending on what's happening at home, depending on what's happening at work, what obligations someone may have, that can impact um, that individual realizing his or her goal. And not putting it in writing, not putting it on the calendar, not scheduling it, not making it a non negotiable is also an obstacle. If it's something that's free flowing and oh yes I can get to it whenever, or yes I'll get to it, or yes by the way everything else comes before getting that accomplished, it will never get done. And so
Hmm.
putting things on the calendar, making it like an appointment, and making sure that you stick to it can help overcome that obstacle. Mindset is also another factor. So If
Mm,
I haven't gotten to the place where I am confident in myself, or I have a team around me to support me in saying, okay, yes, you've done hard things. Yes, this is a health goal that you can accomplish. You can accomplish it despite what has happened in the past. It's hard for me to make that shift. If I'm used to not accomplishing something, what
mm,
makes this year different? Part of
mm.
that is changing that mindset, right?
Okay. You dropped a lot, and I want us to kind of piece it out some because
Oh,
so let's talk about the weight goal.
mhm.
How can we make, like, give me examples of realistic weight loss goals for our viewers who are like, wait, my goal is to lose weight. How is that unrealistic? So how do we transition that to a realistic health goal? What would you
Right.
say?
So we can use the acronym SMART goals. So a specific goal. So let's take weight for example. Wanting to lose, say, 10 pounds in a month or a month and a half or 2 months. Right. It's specific. It's measurable. It's time bound. It's realistic because the average weight loss, recommended weight loss, is 1 to 2 pounds per week. So if you factor on the high end, you're losing maybe 8 pounds, maybe a little bit more, maybe a little less in 4 weeks. Yeah, losing 10 pounds in a month or two is really doable, right? Putting in place the steps, the roadmap to get there is also crucial. So, choosing activities that you enjoy, or if you don't enjoy it, make sure you have that accountability group or that supportive partner, accountability partner to help you along those lines. So, you could say, I enjoy walking, so I'm going to walk 30 minutes moderately brisk activity 5 days per week, Monday through Friday. And I'm going to do that between 5:30 a.m. and 6 a.m. Right. So it's very, very specific, very concrete. So someone from the outside can have that roadmap and just sort of check off as they're observing you to make sure that, yes, those things are in place.
All right, awesome. I don't know if I froze there for a second, but um, you mentioned a few things I wanted to highlight. We've got to make the goal specific.
Hmm.
So I want to lose weight is very vague. I want to save more money is very vague. I want to
Hmm.
I want to have a closer relationship. What does that mean? So I want to encourage you, for those who are watching, big gems she's dropping here. Make them specific, make them realistic, and then schedule them, and then also have a positive peer pressure type system in place. So people who are going to encourage you to do the things and schedule it. All right, awesome. Now, Doc, the second thing you said was time constraints. I have people who are watching like, oh, you have no idea how busy I am. Mom, do that. So how do we overcome that obstacle of the time constraint, Doc? Help us, because we're trying to be realistic too, right?
Right, right, right. So looking at the day, because we all have 24 hours. It doesn't matter what we do day to day. We all get the same 24. All right.
Right.
Um, Depending on the job or jobs we have to be intentional about carving out that time, even if it's 5 minutes or 10 minutes. That's really better than nothing at all because it all adds up in the long run. So if someone doesn't have 30 minutes or an hour, an entire block of 30 minutes or entire block of 1 hour to exercise, for example, break it up in chunks. If you're up at 5 o'clock in the morning and you have stairs in your home, run up and down the stairs for 5 minutes. Get that heart rate up, get that blood pumping, huffing and puffing as you're doing it. On your lunch break, or if you're working from home and you're working remotely, get up frequently, jog in place, just to get that mobility, that physical activity. It's really and truly better to get even small chunks of activity in than nothing at all. And over time, you'll get into that routine. You'll realize how you're feeling. Those natural endorphins are start to be generated, and it's added motivation to increase the time to 6 minutes to 7 minutes to 10 minutes, you feel more empowered to continue along that path, and it sort of build on each other.
I like it. Start 5 minutes. Just start. Now, the next thing you mentioned, I'm going over the obstacles you mentioned. You said
Mhm,
sometimes the reasons why people don't reach their goals is because they don't schedule it. What if
mhm.
someone who's saying, I'm spontaneous. I like to kind of go with the ebb and flow. Why should this person consider scheduling it? Like they don't want to sound rigid. So what would you say to that person, Doc?
I think we can use spontaneity. There's some flexibility there.
Okay.
So, um, if someone, for example, says, I have um, an hour free time,
Mm,
right? They know what time that is. The flexibility uh, would involve the activity. So you may not have to go to the gym. You may
okay.
not have to be restricted to riding a bike or walking. Whatever activity it is that you are engaged in at that time, you can utilize that time to be more physically active, be more energetic. So, um, if you're going to the store, going to the mall, returning gifts, shopping, whatever it is, park a little further than you normally would. Run inside or make a brisk walk inside the store. Um, Take an extra lap around the mall if you're at the mall, for example, or the grocery store. You're still incorporating that physical activity, but you're not limited to 5 or 6 o'clock in the morning, or you're not waiting until 6 o'clock in the evening.
Okay. Okay. Awesome. Awesome. Now, the next thing you said is that the biggest reasons why people don't also reach their health goals is because they don't write it down. Now, for some people, they're like, well, I know it in my head. It came from me. So why do I need to write it down? Can we speak to that? Because you and I both know the power of writing down the goals. Studies have actually shown that it chances are higher. But how can we convince those who are watching like it's worth it? What would you say to that, Doc?
I would say look at what's happened in the past. So, for you, Dr. Tulu, what is it that you've accomplished, say, in the past year? And how did you get there? Were these things that you wrote down and you were intentional about, or did it just stay in your brain and you said, "Oh, I'll get to it. I'll get to it. I'll get to it," because oftentimes it can be a good intention, but
Mhm.
until we put it in writing, until we actually see it, until we take the step of actually writing it, seeing it, breathing it, thinking it, looking at it, repeating it, it doesn't really sink in, and we don't have that motivation and that drive to see it to fruition. So the act of writing, the act of looking at it, the act of reading it day to day sort of solidifies in ourselves what it is we're trying to accomplish. And with that, because we want to maintain this balance, we don't want this dichotomy or this internal conflict, we take the steps to get to that point.
Mm, mm. We're still on question number one. Yeah, we gotta add the new part too, because this is good. And I want to encourage those who are watching to please try this for this new year. Write your goals, make them SMART goals, like she talked about earlier. Write them out, make them measurable, make them time bound, write them consistently, look at them. And then you mentioned something else that I wanted to make sure we didn't miss. It said figuring out the steps to reaching that goal. So let's
Mhm.
give the example of someone wants to lose 10 pounds by March of 2024, or they want to feel stronger, or they want to have increased energy to be able to go up and down flight of stairs by June of 2024. How do you workshop that? How do you like what do you mean by steps, Doc? What do you mean?
Okay. So it has to be a personalized plan for that individual. What is that person's baseline?
Okay.
What are they willing to do? What do they enjoy? So if that individual wants to lose 10 pounds by March 1st, right? We have to look at a few things. the eating patterns, the type of foods that are consumed, the exercise regimen,
Mhm.
and also let's not forget any psychological or mental health conditions that could be impacting that. So, if there is underlying depression, for example, we have to treat that. We know if someone is depressed, lack of motivation is one of the things we see, and it's going to be hard for that individual to realize their goal. So it's a broad assessment of where that individual is at that point, and so we sort of have to tease out the various components before we can actually get to
Mm,
the action steps
mm,
themselves for the exercise routine, for example. Now, if we look at just the exercise, we can say we're going to be specific. The particular action will be walking 30 minutes, you know, um, 5 days per week, and we're going to be consistent with that. Um, we can uh, maybe get on the scale once every 2 weeks or once a week, depending on what your comfort level is, and
mm,
then make adjustments according to that. That's an example of a step. Um, we have the nutritional component, which we can talk about later, but that's also part of it. Um,
mm.
you know,
I love it. I love it. And of course, these are medical suggestions. Very, very important to make an appointment with your own doctor so you can come up with
yes.
that works for you. But doc, I have someone who's watching who's like, yeah, I know I got to eat healthy, but um, that's tough to do. Or they've tried different diets. Is there any, if you could say one thing to someone to encourage them in eating healthier, what would you say would be a first step, um, action wise? Yes.
Yes. Make a list of the foods that you enjoy. Now, fried chicken and cheesecake may be on the list, but I'm sure there are some other healthier choices, right? Healthier items. So make a list of the foods you enjoy. Let's start there. And then look at that list to see, and this is the individual making his or her own
Mm-hmm.
assessment.
Yes.
On that list, what do you identify as the healthier options?
Hmm.
What do you identify as the not so healthy options? And of the healthy options, which ones do you think you could really and truly um, have every single day, or 4 to 5 servings of those healthier options every single day? And prioritize those items. Deprivation, restriction can be
Mm,
very challenging.
mm,
And
mm,
so for someone starting out with those healthier lifestyle changes, it may be a bit challenging or more challenging than need be. And so looking at those food items, textures, for example, may be an issue for someone. So I may say, yeah, you should be eating your beans, legumes, lentils, whole grains, oatmeal in the morning, make your overnight oats. But if that person doesn't like the taste of oats or mushrooms, it's not going to happen. So this is why it's important for it to be a personalized plan.
mm.
And if that individual can look and just make his or her own assessment of what items they truly can consume and what items that are not on the list that they know are healthy, but they're willing to try. All right. It makes a huge difference.
Wow. I love how I love the trajectory of this our live today because we just touched on question number one on my list. And this is good because I think we broke it down in a practical way for someone to start with. And
Mhm.
so for those of you who are watching, don't worry, we're gonna have her back because it's 6:56. We literally have 4 minutes to wrap up.
Oh
But
my goodness.
I know the time flew. We're definitely gonna do this again. But I have someone who's watching who's like, oh, Doc, I hear you. I hear this every year. I don't know. Doc, any words of encouragement to that person to say, hey, 2024, we're starting now, can be your time to have a better, a healthier you. How would you encourage them tonight?
Just do it. To borrow the Nike slogan, just do it. Just start. Jump. Decide. Act. years and years and years have passed, and we're still in the same spot. We're still in the same chair. We're rocking and wishing we could get over there. We're not going to get over there across the room if we don't get up, right? So, whatever that health goal is, just do something. Start. It doesn't matter. It doesn't have to be perfect. We don't expect it to be perfect. We just need it to start. Even if you're starting small, it's just important to start.
I love it. Just start. You heard Dr. Janice Walker. Doc, thank you so much for taking the time to come and speak to us tonight. I have people who are watching who's like, I like this doctor. I like how she breaks it down. Doc, where can people find you to have you come on speak on their stages? Maybe connect with you in South Florida as a physician. And for what other ways to collaborate, Doc, where can we find you?
Sure. Best way to reach me at this point is via email at Janice Walker, LMMD at gmail.com. And I'll be happy to direct you as best I can.
You're also on Instagram as Janice Walker, Janice _ Walker _ MD, and on Facebook as Janice Walker. Go ahead and follow her, like her, support her. She's amazing. There's a lot where that came from. Okay. So thank you so much, Doc, for coming. I really appreciate
Thank you.
And we had quite a lot of viewers. Thank you for watching. Those of you who are watching live and replay, as always, please forward this to people in your life that could use some encouragement when it comes to their health. Your life is too precious to wait. And that's why we keep having these conversations. All right. But thank you all for watching. And as always, if you or anyone you know is looking for a thorough, a compassionate, and a caring family physician who will have conversations like this to help you live long and well in the Mansfield, Dallas, Texas area, I am she. And in South Florida area, she too, okay? All right.
Thank you.
Happy New Year, everyone. And thanks again, Doctor. Appreciate you. Okay.
Great. Thank you, Dr. Toole. Appreciate it.
No problem.